Peptides are something I'm excited about. Fascinating, cutting edge of new medicine and new treatments. And so I just want to kind of go through today, give you a synopsis of what they are, kind of how they're made, what their biologic functions are, going through a little bit of the historical timeline to learn how they came about and how we found them and how we're using them today, and then kind of give you an overview of kind of the safety, side effects, efficacy, and then look at how they are different than pharmaceuticals or hormones, and kind of how they differentiate, right? And then I want to go through some of the popular uses, which you have there, kind of some of them on your sheet, and some of the specific peptides that we use a lot or that are most commonly used. So hopefully it'll be informational, and if you have a question, save it for the end. You can actually, we probably have a small enough group here. If you have an urgent burning question, raise your hand, I'll probably take it. All right, so let's get into what peptides are. These are basically short chains of amino acids, 2 to 50 long. Yeah?
Can you move to that side? Because you're standing right in front of it.
Am I? I may be able to. We may have to adjust the camera, though. We were kind of concerned because of our space, obviously not the most ideal for a lot of people, but we have kind of some overflow over here. Is that better?
Yeah, as far over as you can. That's great.
As long as you can see me. All right. All right, so is that camera, you want to adjust it?
Yeah, it needs to be turned alternate. Hi there.
So we'll get into short chains amino acids, right? And amino acids are kind of the building block of life. They're what make your proteins your body makes naturally. And proteins are typically similarly built, but longer. So the proteins are kind of your long chain. And these are all naturally occurring things that in animals and in us. And they're highly specific in what they're meant to do and what they act on. So going into kind of what peptides can do and how they're used in the body, they act as hormones, growth factors, immune modulators, and cell signaling molecules. They amplify the body's own repair mechanisms, metabolic mechanisms, and regulatory pathways. And they act as the cellular communicator between every function in your body. So we literally have hundreds of thousands of these in our body, and we have access and knowledge for maybe a few hundred currently. So we're just scratching the surface as far as what peptides do and what they can do, and learning quickly, rapidly developing a lot of research going on about. So I think in the coming years you're going to see a lot more about peptides and a lot more uses. The peptides in our body are made in the cells in the ribosomes. Your mRNA codes for it. Then the ribosome goes ahead and puts those amino acids in a specific order and a specific length to give you your peptide. These in the body have a short half-life, so they degrade quickly. They don't stick around a long time. As you age, your ability to make these peptides decreases, just like your hormones decrease, your ability to repair your body, your cellular metabolism and function decreases. So as when we were young, you regenerated quickly, you got injured, the next day you were feeling fine, you didn't scar as easily. So all these things that your body typically had high levels of these peptides when you were younger, and now as we age they start to go down. So this is where bringing those back up to youthful levels can improve a lot of our body's natural function to fight disease, to repair, and many other functions. So pretty cool. And so how do we make them? Like I said, they're made naturally in the body, but we, for medical purposes, they're synthesized chemically, and they're just basically through a chemical reaction. They add on the amino acids into a chain, and they can now make those in mass. And so the technology has gotten better in the last 20 years to the point where peptides are getting cheaper, easier to make. They're still more expensive to make than, say, pharmaceutical medications, which are usually chemical and more stable. But we're getting better at it, and they're becoming cheaper. And They can do it with very high purity, and now they're very easy to make too. So many compounding pharmacies are able to do this as well. Just a little look at kind of the history of how we came about peptides. So the first ones were discovered in the early 1900s, 1902, secretin. And then in the 1920s, insulin came around. We all know that one, and maybe you didn't know it was a peptide, but insulin is a peptide, and that started use in the 1920s. Then as we went forward, then we found oxytocin, vasopressin in the 50s. That won a Nobel Prize. And then Merrifield, a scientist in the 60s, developed the solid phase peptide synthesis. And that's where how we develop these and market them today, how they're produced. So since that time, we've developed further synthetic peptides. In the 70s, they started making them synthetically, mass producing them. In the last 30 years or so, we've just kind of increased the number of peptides we've been able to produce, find, test, and do studies on it and find the purpose and use for these. All right. I will just add, in the last 20 years, there's been a real explosion. They were still quite expensive in the early 2000s, but they were still being used a lot by elite athletes, affluent, celebrities, longevity, recovery from injuries. So the last 10 years or so, they've started becoming more well-known. They've started becoming more affordable, more accessible to the average person. And I know a lot of you had questions about safety and efficacy, and so I kind of want to touch on that a little bit. Some of the strengths that I had mentioned was that they're very target specific. So these peptides work only in one area of your body, and comparing that to, say, the pharmaceutical medications often are blocking a certain enzyme or pathway in your body, and that can often be blocking in many areas of your body, so they're much less specific. And that leads to potential downstream effects. The other thing about these, just to note, is that they're typically upregulating a body's natural process. They're not blocking, typically. But most pharmaceutical medications are the opposite. They're typically blocking or they're inhibiting a natural process of your body. And with that comes downstream effects, potentially long-term effects or side effects that are more likely to happen, right? So just in the general profile of these peptides is that they're very low toxicity, they have very few side effects, and typically when you do get side effects, it's more of a dose-related issue. So just like anything, if you take too much of it, a little bit may be a good thing, too much often is not, and you may have some side effects or some negative adverse events down the road, right? Just like hormone replacement, we may think about that, like you have an optimal level, you have a low level, and you have too much. If you're in that optimal level, you get all the benefits. If you're too low, you have risks, and if you get too high, you have other risks. So I think about them similarly to the hormones in that we want to try and target an optimal level with our peptides. So generally, they're excellent safety profiles. The common side effects, especially with, like, say, the GLPs, is nausea, flushing, sometimes histamine reaction if you're getting too much, where you kind of turn red or get dizzy. Most of these just go away after a few hours, couple hours, if you get that reaction. And the fix is typically reduce that dose. Your body also kind of tolerates it less the first time you do it, so it's a good idea to go low and slow with anything you're doing. Start with a lower half dose. If you tolerate that well, you go up. And then many of these are FDA approved. Like, you may not realize how many, but there's probably over 70 FDA approved peptides that have gone through rigorous safety testing. And these are proven in diabetes management, cancer, hormone health, fertility, obesity, osteoporosis, wound healing, immune modulation, cardiovascular health, neurologic disorders, gut healing, and infection treatment. So we have peptides that are FDA approved for all of that. Many of the peptides we're using and on that list are still not FDA approved or evaluated. And what that just means is the FDA hasn't looked at them to approve them, right? We'll get into that a little bit more here in a minute. I want to go into a little bit more kind of to differentiate pharmaceuticals and peptides, kind of what some of the differences are. So like we mentioned, the peptides are short-chain amino acids. The pharmaceutical drugs are synthetic chemicals. The peptides are very specific, and the drugs often block enzymes, receptors, or pathways more broadly. High target specificity with the peptides, which leads to fewer off-target effects. They're also broken down, like we mentioned, pretty quickly. And when you break down an amino peptide, you get amino acids, which is something your body readily uses as fuel in food, right? And can reuse. So you have the metabolites of sometimes with drugs, you break down, you get a metabolite that may be toxic or you have to clear. So the downside potentially is that to get the bioavailability from these peptides, they are amino acids, so they don't have a lot of stability in the gut. Your gut's going to digest them. And so the majority of them you can't take orally. There's a few that do have good stability in the gut, such as BPC 157, but most of them are going to be subcutaneous injections, right? Small little insulin needles. If you're a diabetic, probably not a big deal for you. So yeah, and you know, your oral pills are very stable. You can put them on the shelf for 5 years and they really still have pretty good efficacy after that. But so then, yeah, and the peptides, again, are going to be a little bit more complex process for developing and manufacturing. So they tend to be a little bit more expensive. The drugs, pharmaceutical drugs, are typically cheaper, easier to make, easier to scale. So just the way it is right now. And I think as we continue to develop better techniques, this is going to get more efficient and more cost effective with time. And here's some of the things, you know, I hear and you see out there, news, whatever. I just want to go over a couple like, you know, myths and truths with peptides. One of the big ones is peptides. People think peptides are illegal, and really that's not true. What they are is just most of them are not FDA approved. Many of these just have not gone through that process, which requires large, you know, 3-phase trials, cost millions of dollars. And the money for that typically is not, there's not an incentive for pharmaceutical companies to do that because these, like I said, these are easily found and available. You can't really patent an amino acid or a peptide. So they have to come up with, if they're going to patent something, they have to come up with either a proprietary way of formulating that or adding something to it to try and make it a little different or better. And that's the road they went down with, say, like the GLPs, right? Because they could see the cash cow at the end of that, right? But for right now, there is a limited amount of studies, and most of the studies and knowledge we have of the ones that aren't FDA approved is early animal models, which there's a lot of animal studies, and then like there's some preclinical human trials, and then we have a ton of anecdotal evidence where just people have been using them for decades, right? And we just see through that, like they have a very good safety profile as well. And the ones that we do have tested and run through FDA, they all have excellent safety profiles. So we can kind of extrapolate that in general, these are pretty safe compounds if used, you know, responsibly. Another one is like peptides are like a steroid, which just isn't true. Steroids are synthetic, you know, hormone stimulators. And what we're doing here with peptides is a natural stimulation of your body's own natural process, right? So, and the nice thing about your body's systems in here is you always have a feedback loop. So you stimulate something in your body, there's always a reverse feedback loop that says like, oh, you're doing that too much, I need to suppress that. So when you're stimulating a natural process, even with like your hormones, you get a high level of testosterone, it's gonna feed back and around and tell you your body to stop making that. Same thing with peptides, so they kind of go through a similar feedback loop. Which again leans to the fact that they're pretty safe. You're doing something the body recognizes and inside that metabolic framework, right? And some people think this is a new or untested treatment, but I think we went through the history here. We've got a lot of history with these. And a lot of people think, well, you hear about them for anti-aging and that's what they're for. No, as we talked about, and as you can see on here, you know, there is almost limitless possibilities for what they can be used for and will be used for in the future. And peptides are dangerous. That's one that I think by the end of this talk you'll have a better idea that overall they are very safe. We've got hundreds of uses for them that are FDA approved, and the more we learn about them, the more evidence we're finding that in general they are very safe and well tolerated. This is what the Wisconsin Institute of Functional Medicine had to say about peptides. Peptides precision allows for the development of treatments that can mimic or influence natural biologic processes, offering a targeted approach. And that's just a good summation of kind of what we're talking about with these. And just a quick word on the regulatory environment. We touched on it, but there's no doubt that the FDA, mainstream media, has been suppressing peptides. And just like they suppress a lot of things that work and that threaten big pharma's bottom dollar. This is pharmaceutical companies own the mainstream media by and large, and so what you see a lot of times in the mainstream media you need to take with a grain of salt. There's a lot of fear motivation out there, and I think RFK just had recently stated he was accusing the FDA of suppressing the use of psychedelics, peptides, stem cells, raw milk, and hyperbaric therapies. So right now, the current administration is trying to work to loosen those, and they're looking to loosen the regulations on these research peptides. In the Biden administration, they took a bunch of them off the list, which made it illegal to compound by a 503A pharmacy, so your doctor couldn't prescribe it, basically. So right now, most of those are off the list, and we're getting from 503B pharmacies, which are research pharmacies. So when you get your little vial, it's going to say for research purposes only, right? And so that's kind of the regulatory framework we're working in right now, and hopefully that'll be loosened in the near future. They're still totally legal to use and to obtain, and you can find them sometimes online, but I always caution when I tell people that what you find online is probably 75% of it's junk. A lot of it's coming from China. You don't know how pure it is or if it's adulterated, so it's important to have a trusted supplier, right? Somebody that's doing third-party and purity testing. And as I mentioned, the peptide industry is growing in leaps and bounds. It's already a $70 billion industry globally. There's almost 500 new peptides currently in development. And as I mentioned, we've just seen an increase in production due to increase in technology to produce these. So there's a lot of forecasts that these are going to take the place of a lot of pharmaceutical medications. They work in general better once you have the targeted approach and you find out what you're trying to treat. These peptides do better than a lot of the pharmaceutical medications. So there's a lot of predictions that we're going to have a lot of the pharmaceutical medications will be outdated or will be replaced with peptide therapy in the next decade or so. And let's get into a little bit about what peptides can do for us, right? And how you might want to use them. So this is just some things. I mean, if you have disc pain, chronic pain, low back pain, we have peptides that are going to decrease inflammation, increase healing, decrease pain, joint injuries and acute injuries, ligamentous injuries, and post-surgery, peptides that will help you recover way faster with less long-term chronic inflammation, muscle recovery and performance for our athletes or those trying to build lean muscle. We have peptides, multiple peptides to help with this. Gut issues, IBS, leaky gut, ulcerative colitis, peptides for healing the gut. We have several of those and they're very effective. Autoimmune disorders, somebody has an autoimmune disorder, it's a good idea to think about this as well, of any kind. Even in the cancer therapies now, we're finding peptides that either boost what you're doing medically with chemotherapy or just improve your body's own ability to fight that cancer, right? Improve your immune system. We have peptides that fight bacteria and viruses, so acute infections, now you should be coming in, getting a peptide shot if you got the flu. You're going to get better faster. You're going to boost your immune system just big time. People with skin conditions, eczema, dry skin, We have peptides that are going to improve that. Metabolic disorders, obesity, diabetes, right? Lipid disorders or cholesterol problems. We have these peptides can work on that. People with chronic fatigue and commonly with the metabolic disorder is mitochondrial dysfunction, which your mitochondria are just the powerhouse of your body and your cells. They're producing the energy. That's what then provides you with energy and ability to move, function. So all of your cells and all your organs need this. So these mitochondrial peptides are being looked at heavily for longevity. So if you can keep all your organs functioning well and your brain functioning well, you're going to live longer, right? So then we have, you can look at it for thyroid dysfunction, which is, often autoimmune, hormone imbalances, neurodegenerative diseases, dementia, cognitive decline. All these things are things that we can think about managing with peptides or adding to what you're doing currently. These aren't always necessarily a replacement for a medication, but oftentimes they go along with that, or they may replace that medication potentially, right? And many of these, we just don't have medications that do these things. There's nothing that we have that increases your mitochondrial activity that's a chemical, right? So peptides are really it. So yeah, just as I mentioned, and I'll just I put this in here to show you, just run through some of the top benefits which I mentioned, but you've got your MOTS-C and epitalon affecting your anti-aging and longevity. Your BPC and your TB500 are the ones you may have heard about, but those are big for the healing of injuries, tissue repair. Your metabolic disorders and weight loss, that's your GLPs and also your growth hormone secretagogues. These are, we'll talk more about these in detail, but I just kind of wanted to give you an overview. Your MOTS-C and SS31 for mitochondrial support. Your performance and athletic recovery is also going to be MOTS-C, CJC, SS31, IGF. Your gut repair ones are your BPC and your KPV. Your skin rejuvenation, GHK, copper, SNAP8, LL37. These all have some benefits there. Thyroid and immune dysfunction, thymosin alpha-1 is your big immune booster, promoter, and kisspeptin with some of the hormone that's going to increase hormone production. And then your phenaleon and Cmax and epitalon, those are your neurocognitive repair and optimization peptides. And then Selank is a powerful mood stabilizer, kind of anti-anxiety medication or peptide that just stabilizes your overall mood and effect. And the nice thing about that, it doesn't have any withdrawal or crash afterwards. So like you might with your anti-anxiety medications that we have currently pharmaceutically. And so I'll just go through some of these peptides for us and we can discuss them and kind of go into a little more depth and understanding. And we'll start with the big one. Probably people have the most questions about, the most fear about, the most unknown about. Semaglutide, tirzepatide. Now the next one is retatrutide, right? So we have 3 different phases or classes of these. That the first ones, the first iteration came out in 2017 with some semaglutide, powerful appetite suppressant, and slows GI emptying. So you kind of have less desire to eat, you eat less calories, you lose weight. And that became real popular real fast, as you probably all know. But also, you heard about, wait, that's causing me all these side effects of nausea, diarrhea, pancreatitis. And so those were real. People do get those side effects. And like I say, most of that, one issue was because you had a very powerful satiety impulse plus a very delayed gastric emptying. And then people were doing it to lose weight rapidly. And people were losing weight rapidly and still are, right? But what happens when you lose weight rapidly due to caloric deficiency? You lose fat, but you lose a lot of muscle too. So if you're not doing these right, if you're not basing this on good diet and exercise, strength training, you can run into trouble with GLPs. You're going to lose a lot of muscle. And what is the powerhouse of your body for keeping your metabolism up? It's your muscle. Your muscle uses more ATP, burns more fat, So when you stop taking it, what happens? You quickly gain back. So those are kind of cautions about, the GLPs, is that if you're doing them, they are a powerful tool to help optimize and give people ability to get past that where they otherwise haven't been able to lose that weight. And some people think, well, that's kind of cutting corners or cheating. And I would say yes, in a way, but I've just seen so much good from it in people that get motivated, incentivized once they start seeing those initial results to like, oh, I can get healthy. I want to work out. I want to increase my muscle. What other peptides can I use? But just I'm seeing amazing transformations in people. I'm seeing that going along with metabolic disorders improving, so their insulin resistance coming down, your lipid function, triglycerides coming way down. So that first iteration was just a GLP-1 agonist. Now then the tirzepatide is a 2 agonist, so it adds the GIP agonist, and the third generation, which is not yet FDA approved, but in the end phases of the stage 3 trials, or phase 3 trials, is a triple agonist, and that's adding in a glucagon. And so what's happening now is the newer retatrutide, the GLP-3 is showing much lower side effects. It has a less effect on your satiety and the gastric emptying, so you get much less of the GI side effects, and adding in increased insulin and glucose sensitivity, and then increasing your metabolic rate as well. So instead of just caloric deficiency, you're kind of getting partial caloric deficiency plus increased metabolic rate, and then increased partitioning of your nutrients, so it's more nutrients being pulled out of fat and liver, glucagon, and being mobilized to be used by the body. So you're losing weight in several different ways here, and you're also improving a lot of the metabolic dysfunction that a lot of people have with diabetics and obesity. So I think they are powerful peptides. Obviously, they're the biggest ones out there, the most talked about, and for a good reason. I would say, the third generation GLPs seem to have the best, they've improved with every generation, but these triple agonists are showing low side effects and even greater weight loss and less muscle loss. All right, so. And just to add to that, mention here, people are also feeling increased energy and neurocognitive benefits. So kind of that brain fog stuff, a lot of that goes away. And people that are on them, they'll tell you kind of what happens, physically is you just suppress that dopamine surge that you get with eating or with anything else. So you just have like less desire to go grab that, quart of Ben and Jerry's or cookies or whatever. And when you eat, you want to eat. Especially with the GLP-3, you still have that hunger and desire to eat, and it tastes good, but you get about less of that meal before you feel like, oh, I'm good. I don't need that. I don't need any more. So for a lot of people, that's just a powerful thing. And I've seen it cross over into other kind of dopamine specific issues, whether it's addiction. You can have some effect there where you just have less desire to do whatever it is you're addicted to because it's a dopamine hit. So this is kind of lowering that down. So potential in, addiction kind of medicine too. And there's several of these that are kind of along that line that also cross over a little bit. And so the BPC-157 is probably the next most known, widely used peptide. This is the body protective compound. This is found naturally in your gastric juices and the stomach and duodenum. This is your regenerative peptide for healing and regeneration. This promotes angiogenesis or new blood vessels into the areas that are injured. It promotes collagen synthesis to the areas that are injured specifically, and tissue repair. It's a strong anti-inflammatory, and it's also strongly protective of the gut, right? You could find these, the closest way to get BPC elevation is in your diet is by ingesting bone broth, fermented foods. These are going to be things, and collagen-rich foods. These are things that will increase the BPC in your gut. And as we all know, these are kind of gut healing diet protocols for a lot of people. So you can see there's probably some correlation there. But yeah, the healing ability of the BPC 157, especially in, is really powerful, especially in acute injury, post-surgery. I really, I can't see why we wouldn't be doing this for anybody that has an acute injury. Anybody that's coming out of surgery should be on this. There was a rat study that they did where they went in and cut the Achilles tendon of a rat surgically, and then they injected BPC in him. That tendon repaired itself and came back together. And just in anecdotal evidence, we're seeing athletes' injuries being healed in much less time. So it is being, used at the higher levels. And but I believe this was one also that is on the WADA banned list because of it's so powerful for inflammation, regeneration. People also use it that are athletes that want to increase or build back muscle quicker when they work out. They're going to regenerate that tissue, and it works faster. So there's a bunch of these that are on that WADA list. I'm not sure how they test for them, but that's just the World Doping Organization, if you're not familiar. But these aren't, like I said, steroids. These are just natural compounds. And the BPC is notoriously safe at multiple dosings. You can take very large amounts, has almost zero side effects. We haven't had any long-term issues with it. This is one we've been using for a long time. It's also the one that can survive going through your gut, so it is something you can take orally. And maybe for those who are directly addressing gut issues, taking the oral version may be a good option. But in general, you can take this, systemically just through a subcutaneous injection, and it goes preferentially to the injured or torn down areas. And this one, TB500, this is often paired with your BPC 500. Follows a lot of the similar pathways. It's another powerful regenerator, healer. It promotes cellular factors, healing factors to go to the area of the injury. It increases blood flow to that area of the injury, which again brings more healing factors to the area. It promotes remodeling of the tissue and reduced scar formation. So you get better faster, you have increased flexibility, faster injury recovery, decreased inflammation. And this is pretty well studied too, and really safe safety profile. This one is naturally produced in the thymus, which we have a lot more of when we're kids, right? You got the thymus gland. Typically, you're going to be doing these for a period of time, a course, maybe 6 to 8, 12 weeks during an injury. Most of these peptides are not something you want to do every day forever. You do need to give kind of your cellular pathways and receptors a break. I think that's wise just in general. But so most of these protocols will, have a few weeks or months protocol, take a break, maybe go to a maintenance dosing on some of these. Because some of them are as safe long-term as if you're doing it kind of on a maintenance dosing, right? But when you're first treating, say, like an acute injury, you go a little bit heavier and harder with these to get the maximum benefit. And then the growth hormone secretagogues. These are peptides that in some way, shape, or form stimulate your body to make, your hypothalamus to make more growth hormone. And growth hormone is a master hormone for a lot of things: longevity, strength, fat loss. These are gonna increase your lean muscle mass. They're gonna be, you can use them for targeted fat loss. There's an FDA approved for tesamorelin for visceral fat loss. Sorry, guys. And so they're also going to be in effect and improve your sleep quality, improved energy. These can be used for increasing bone density as well, so osteoporosis type use, and anti-aging. So growth hormone, again, is one of those that we have in high amounts when we're younger, and kind of declines with time and goes right along with, you know, our bodies declining, our ability to, our strength and everything else. And there's quite a few of these growth hormone secretagogues that work in different ways. I don't want to go through every one of them, but you know, I'd be happy to have you guys come in and visit me and have a little chat about these and how they might be best for you and how best to use them. This one here is another, goes along with the growth hormone secretagogues, but this is kind of one of the end products of this is a peptide that's just a short chain of the growth hormone that specifically works on increasing muscle growth, repair primarily, so increasing lean muscle mass. So those that are training or trying to increase lean muscle, this is an excellent add-on to maybe doing some of these other things. This one you typically are using before or right after you're working out, say. And a lot of, you know, people that are training, athletes, bodybuilders, this is one they're using. And this one is a very popular one in the aesthetics industry, but it goes beyond that as far as uses. This is the GHK, or the copper peptide. This one is one that regulates and upregulates your collagen and elastin production. It modulates gene expression for repair in the skin and other areas. It's a powerful antioxidant and anti-inflammatory. This one is used a lot for the different skin conditions. It can be taken systemically. They also put it into cosmetics and into creams, so it can be placed directly where, you know, the affected areas. A lot of people are using this in the beauty industry. It does make your skin healthier, tighter, glow. It's popular for a reason, and it's still fairly expensive, especially in the cream form. But you can get the similar effects for the whole body by doing it systemically for a lesser price. This is also awesome for like wound healing, chronic wounds, post-surgical skin healing. If you have a large wound, for healing that, this is awesome too. Now, thymosin alpha 1 is your strong immune modulator. This is one that matures your T cells and really enhances your overall antiviral immunity and anti-tumor immunity. So this one kind of modulates and upregulates your immune system to be able to fight the things that you need to fight and protect the things you need to protect. So we're seeing faster recovery, stronger immune response, support in autoimmune disease to help kind of downregulate your body's own. In an autoimmune disease, you're fighting your own body or your own cells. So this kind of helps modulate that and improve it. This is one that's widely used, is clinically in other countries have, you know, had it approved and it's been used. So this is one that's great, like I said, in an acute infection. Also, if you come in and boost yourself up with thymosin alpha, you're going to help yourself out there. And that's often paired with this one, which is LL37. This is a powerful antimicrobial, antiviral, and it's pretty broad spectrum. It also has some immune modulatory function and also some wound healing properties as well. So, you know, this is one that can be used similarly for infection control, wound healing, anti-inflammatory effects. There's quite a bit of science and studies behind this one as well. So I see this one in maybe pairing these two as an excellent, you know, fighting infection, chronic illness, or autoimmune or cancer potentially. More the thymosin alpha for that than the LL37, but pretty cool use case for these. Here's one that's a little less medical, maybe a little bit, but it is really popular. People are using it, so I thought I'd tell you about it. You know, it's been dubbed the Jersey Shore peptide. This one comes, it's gonna tan you, so it stimulates your melanocytes through the hypothalamus, and so quite rapidly you can develop a good tan. It also has some appetite suppression, which people like, and then it also enhances libido and erectile function. So it's pretty powerful in that aspect too. You know, and this one most people are on for a couple weeks to get that tan or whatever. I would say, you know, the increased libido, it might be a good side effect, but you don't want to take this one long term or you're going to turn really dark. But yeah, it is a popular one because of those functions that it does. And you know, if you have an erection longer lasting 6 hours, call your doctor. And this PT-141 is similar as a central agonist of the hypothalamus to enhance your sexual desire and also erectile dysfunction, and also in women for libido. It's a powerful one too that can be used for those purposes. It lasts, you know, you can use it as needed. It lasts about 48 hours in your system when you take a shot of this. But a lot of people, it's FDA approved in a drug called Vaselci, but we're getting it, you know, through the compounding pharmacies outside of that. So a lot of people are using it for specifically people with ED issues, libido issues. Again, you know, I always recommend, like, first get your diet, health, a lot of that weight under control, because that's going to help. Secondarily, your hormones, because that's going to be a big part of this. But this is another tool in the tool shed for that. And also, a lot of couples, you know, are using it to go up to the cabin in the woods for a weekend and get away and have a good time. So I'll tell you a little bit. This is some of your nootropics or nootropics, Cmax and C-Link. These are brain-derived neurotropic factors. They enhance neuroprotection. The C-Link is one that modulates your GABA receptors and immune responses, and has powerful anti-anxiolytic effects. So for those with increased anxiety, moods, mood swings, this one is a really kind of mild, helpful in that case, and like I said, safe and doesn't have any of the drawbacks of when you come off it, you shoot back up or have withdrawals. And so that can be used kind of on an injection once daily. The Cmax is a powerful nootropic for focus, memory, increased learning, and so that one, often these two are paired together. So they come in a vial together, so you can get kind of both effects. And this has, you know, some clinical trials primarily coming from Russia on these, which they've been kind of a leader in more of this space as far as early studies. It's, like we mentioned, it's been pretty limited in the U.S. just because of funding. This is a cool one, the pinealon or pinealon. This is a brain-specific bioregulator peptide that crosses across your blood-brain barrier. It interacts with your DNA and chromatin to regulate chain expression, reduces reactive oxygen species, which are it's an antioxidant. It modulates your MAPK and ERK pathways, energy modulation, and supports neuronal survival and proliferation. So this one is being looked at and being used strongly for neuroprotection, for those with cognitive dysfunction, memory issues. It also promotes better sleep and circadian rhythms and reduced neuronal death. So this is another one of those looked at for those issues and also anti-aging. So if you're reducing that neuronal death, keeping those alive for longer, right? And then MOTS-C is a big one, real popular one that is functioning at the mitochondrial level. So this is one of your longevity, but also energy, cellular energy, cellular function. It activates your AMPK pathway, and your AMPK pathway is the master kind of regulator of your metabolism. And this has been being studied for longevity, and also fat loss, physical performance improvement. You're going to have increased energy, increase your basal metabolic rate. And this also shows that signs that it's making more mitochondria, not only protecting and increasing the ones you have, but biogenesis of mitochondria, so new mitochondria. And so they're using it. It also has some evidence for insulin sensitivity improvement, obesity, insulin resistance, increased exercise performance. I think we went through all that. And this is one that typically you're doing a short course of maybe 15 days, 2 or 3 times a year to get the benefits from this, right? It's not one you kind of can do every day. You can overdo your mitochondria. SS31 is another mitochondrial protector and influencer. It's stabilizing the mitochondrial membrane. It's increasing ATP production, which is your cellular energy. It's strong antioxidants. It's supporting production of new mitochondria as well. It's been shown in studies with looked at for congestive heart failure and post-MI protection and rejuvenation of the cardiac muscle. It improves renal function and slows renal deterioration in those with those issues. Enhances muscle endurance and gives increased energy overall. Another anti-aging longevity applications with this one, and then also some neuroprotection. People with chronic fatigue syndrome, this can be a real powerhouse. People with mitochondrial dysfunction, oftentimes they're people that are in good shape or athletes that just burn out their mitochondria. They're training too hard and for too long, and going on a course of this for a month or two gets them back. And this is a big one, epitalin. This is derived in the pineal gland of your brain, and it stimulates telomerase activity. It also boosts your melatonin production and a strong antioxidant, and modulates neuroendocrine immune function. This one has been strongly looked at for longevity, and there's a lot of studies that show that it can help that. The telomerase, if you're not familiar, is what kind of protects the end caps of your DNA. As you get older, you take hits to that DNA, whether it's toxicities or environmental, you lose those telomerase. They get shorter and shorter, and that correlates with longevity and how long you live. So what this is doing is lengthening those telomeres, providing increased protection for that DNA, so you're going to have less risk of, say, mutation, cancer, other deterioration of your body, right? There's a great study with showing up to 28 to 50% mortality reductions in older adults over 6 to 12 years, which is pretty impressive. And a lot of people, like I said, report a lot better sleep quality and circadian rhythms. You're increasing that melatonin, which is another hormone, right, that decreases as we age. We sleep less well. So pretty powerful. And this is another one you only need to do potentially, 2 or 3 times a year for like a 10-day course to get the benefit. So anyway, that kind of gets through all the peptides, and it comes to the end of our conclusion here. Just the main kind of takeaways is that the peptides are pretty revolutionary discovery and rapidly expanding in what we're able to do and the uses for them. There's the market for them is increasing rapidly, and in the near future they are going to continue to overtake pharmaceuticals in a lot of areas. With anything like this, moderation is kind of the biblical goal of what we do, right? Like, if there's one diet in the Bible, it's moderation. So I kind of take that with anything we're doing. If you're doing these things, you shouldn't be doing them all the time. You need to not be overdoing them or abusing them, but done the right way and optimizing, they can be really safe and really effective for a lot of people. Many of them, and for the most part, people do experiment and play around with them, but I always tell you it's a good idea to have somebody that knows what they're doing, knows a little, a doctor that understands these things a little bit to kind of guide you through this, because you can get yourself into trouble. Some of these may increase your A1C or your glucose, some of the growth hormone ones. So there's other things that you need to watch out for that maybe you don't do together. So always a good idea to be safe and consult with someone that knows what they're doing. All right. Yeah. Anybody have any questions? Yes, sir.
Yeah, for men over 60 who are interested in growth hormones and security docs, what would be your initial recommendation? And then at what point after you initiate therapy would you check your IGF-1?
So, great question. And it can be a little bit patient specific in kind of what you're looking for. If, like I said, with the a good, so your strongest ones are going to probably be your tesamorelin, your CJC. You're going to get the most targeted fat loss, visceral fat loss with the tesamorelin. You increase the kind of the safety profile and effectiveness by adding, say, an ipamorelin. So great way to go, and I think how I typically would do it is put a tesamorelin with an ipamorelin and run that for, say, a 3-month course. Then get an IGF, checking that. You want your IGF to be kind of in a safe range. After that, you know, you're probably taking a break. You may switch over to doing a CJC and an ipamorelin, kind of moving it around a little bit to just kind of using different receptors, different pathways.
What's your opinion on sermorelin?
Not one I'm using a lot. I think just kind of weaker, older generation, just outpaced by the tesamorelin and ipamorelin. Yeah.
Besides injections, there's also some nasal spray. Are those
Yeah.
effective as well?
Yeah, so you get pretty good bioavailability with nasal spray, and a lot of these are. So like the Salink C-Max, for example, is a great one that you can do with a nasal spray. We're actively trying to acquire and find a supplier for it, because there's that one and some others that you can do nasally. So, you know, there's also the opportunity for doing these intramucosally, like in the mouth, and just letting it absorb through the mucosal membranes. Anything that avoids the gut, right, is a potential to get good bioavailability for these things. Yeah.
What's the best one for eczema?
So eczema, probably a couple ones that I'd recommend trialing would be like the GHK copper, and then paired with like a thymosin alpha, kind of immune modulator. Those two would be something I would try in like an eczema case. And then, so.
What do you think about the NAD+?
NAD plus.
I hear about that a lot.
Yeah, NAD plus is it's technically not a peptide. It's a coenzyme, but it's powerful in kind of like similar fashion as a lot of these peptides. So a real cellular energy booster, potential for longevity. This can be taken in pill form and kind of the precursors to NAD, NMR, NMNR, and NMNH. And you can also take it as an injection. You can get it as IV infusion. We do those here too. But this one, yeah, you're going to feel increased energy, kind of concentration, ability, you know, endurance, cellular health. So it's a powerful one.
Any suggestions for liver health?
Yeah, so the biggest ones for liver health are probably going to be one, the growth hormone, like a tesamorelin, which is reducing kind of fatty liver issues. I would pair that also with like kind of a low dose GLP potentially. You get a lot of the metabolic effects of the GLPs at low doses, so you don't need these high doses for like that you might be shooting for weight loss or diabetes control. But I'm still, even with the low doses, we're seeing, you know, lipids profiles improving drastically, liver health. And then pairing that with like glutathione is a powerful antioxidant. Again, not a peptide, but
Anyone specifically to help with the joints with the arthritis and stuff like that, be more comfortable?
yeah, I think the BPC TB500 are kind of your go-tos there, right? And if you have a specific joint that's bothering you, you know, you can actually inject it near that joint. The idea is you get a little bit more benefit doing that. Not that that's definitive, but that seems to be the anecdotal practice that most people are going with. Yeah. Yeah. Yeah.
The GLPs, what's the process of once you've reached your goal,
Mm-hmm.
how do you get off of it? Or are you on it forever? for
Oh, good
maintenance,
question.
or-
It's really patient specific, I think. They're typically, if you can not be on it long term, that's better. When you're coming off it, again, we're talking about like, we're getting you to a goal and using, but also in that process, you need to have some lifestyle changes, right? Or continue the ones that were good that you had that just weren't working, right? But now, if we can add maybe a growth hormone secretagogue at the end of that to increase muscle longer term, have better metabolic rate, keep that muscle off easier, And when you are coming off them, it's not something you want to stop immediately. Like, I'll usually keep somebody. It'd be a good idea to keep them on it for a prolonged period of time at just kind of stepping down slowly, and then maybe that person stays on at a low dose for the metabolic benefits for a long time, right? Yeah.
How is dosage determined?
Yeah, great question. Again, because these aren't FDA approved, we don't have these standardized protocols for all of them. Some of them we do, like the GLPs, right? Well, you can start at 2 milligrams and go to 12 or whatever. But many of these we're looking at research dosages and then extrapolating that to people. And then anecdotally, what are people using and have been using that is effective? Where do you run into problems? So it's a bit of a art and a science here. Where your dose where you might have a benefit maybe here, maximum benefit maybe here, and too much maybe there. We kind of know generally on most of these a good safe range, so we kind of stay within that where people aren't having side effects and there's not really any risk or real concern for adverse events with that. So that's kind of how we do it. It's
Can you also use more than one peptide at a time?
Yeah, good question. So most of these, you can use multiple peptides at a time. There's not really any contraindication to doing that. There's a few that you might be best not to do together or do too many at a time. You're just kind of overwhelming your body and you're not sure what's doing what, so it's a good idea to kind of, again, start kind of slower and lower, but as you go, if you have, 3, 4, 5 peptides, no real contraindication to doing that, yeah. Because they are so targeted, we're working on a specific target. There's just not a lot of crossover or issues there. All right.
Okay.
Thank you.
Thank you guys. Thanks for coming.
So I'll just review really quick, just so everybody has all the information that they need, because I'm sure we've answered every question. So the common peptides on the front of the handout are ones that we typically have here available, but also don't necessarily require a consultation. So if you have some experience or you feel confident enough just to hop in and pick some up, then these are available at any time. The ones on the back are the ones that we would recommend doing a consult with Dr. Tribble or a provider that you know. Any of them that's available, obviously, but that just kind of gives you an ability to say how specific for me is this a good idea, here's my situation, et cetera, et cetera. And so that's available. We did want to offer to you guys, if you do want to do a consult, it can be in person or virtual. But the price is on there, and then also just a thank you, 25% off, up to $100 off your peptides that you get with that consult. So, so basically for $97. And then I do have, as you guys can tell, I can't list every single thing on the handout. There's so many of them. So again, as many as I could, I put on here as far as the price sheet goes. So you're welcome to pick that up. And so some of them are come in multiple size vials. So if 10 is the first one, then the first price is the 10 milligram. If 20 is in the middle, then the 20 milligrams is the second. Everybody got that? Okay. So again, I'll stick around. You guys have any questions about these, but I'll let you pass this out as well. And then please feel free to hang out. Take some, pass those back. I'll start at the back down here.
So
Go.
that may be good if you actually have